Well, ICE is just one of the examples of, the aggressive cutting-edge technology that is out there that we have made available to the residents, of this community, and have made a fourfold increase in the life-saving numbers that have responded to cardiac resuscitation and been able to successfully walk out of a hospital and resume their normal daily functions and activities of daily living.
It's induced cooling by EMS. It's hypothermia that Nature Coast EMS starts in the field and we continue here on patients who've had a cardiac arrest and they've gotten a rhythm back.
I think one example, really tells it all, and that's the ICE program. That was really a joint venture on the part of our emergency department, the emergency medical services department, if you will, and our heart program. And together, the three of those programs, the three elements, work together to develop a very, very state-of-the-art program that not necessarily saves lives, but really improves the quality of life of the patient after they have a major coronary event out in the field. We were the first hospital, the first area to do this nationally in a rural area, and that was all because the relationship between EMS, the hospital emergency department, and the heart program. And people are really reaping the benefits of that today.
From this procedure, we have seen people who were essentially dead wake up without damage and walk out of the hospital and lead normal lives. So it's very exciting. It's something that we're very proud to offer for our community, and we could not have done it without Nature Coast EMS.
Well, welcome back to Every Minute Counts. And we're here with Jane Bedford, and I'd like to ask Jane some questions. Nature Coast EMS was the first EMS service in the state of Florida to implement ICE, and one of the first in the country. Can you tell us a little about ICE and why it's so important?
Yes, thank you, Mike. ICE stands for Induced Cooling by EMS, and that's something that comes secondary to what we were talking about earlier is doing CPR. When somebody has a cardiac arrest, their heart starts beating, and when we get a pulse back and we get the heart start beating again, sometimes those patients don't wake up. And what they found with research is that if we cool the body down to 91 degrees, that increases their chances of waking back up. So we saw this evidence come out of the 2005 American Heart Association guidelines 5 years ago, and Nature Coast EMS was convinced that this was a treatment that we should be partnering with, and Citrus Memorial Health Systems was a local hospital that also agreed that we should be doing this. So Nature Coast EMS became the first EMS service in the state of Florida to offer induced hypothermia. And what that means was when we do a cardiac arrest and we get a pulse back, a recirculation, and they don't wake up, we start cooling their body temperature down.
Wow, and how do we do, how do we actually cool them down?
We keep chilled fluids in a cooler in the truck, and those chilled fluids are infused into the body after we get circulation reestablished and we identify that this is an ICE patient. Then we also use ice packs, and we put them at certain points of the body that will, when the blood circulates close to the surface there, it actually cools the body down by cooling the blood that's circulating through the body down. And our goal, our target, is to bring them down to 91 degrees. Literally, in the ambulance, we're only able to drop their temperature 1 degree with doing what we're doing. But the science has proven that starting that procedure as soon as possible after an out-of-hospital cardiac arrest increases this patient's chance of walking out of the hospital.
That's amazing. So why is it, what does actually the cooling do to make the body recover from a cardiac arrest?
Well, it's funny, with the CPR, we think we're smart and we change things and we add stuff, and then eventually the science shows us that we should go back to what we were doing in the first place, and that's really good chest compressions. Well, induced hypothermia actually has its roots at the Civil War. And someone did a study and actually did some data collection on the fact that the soldiers that they didn't bring close to the fire, that were injured, actually did better than the soldiers that were brought close to the fire. So that's the really, really far out roots. But the recent history is this. After you have a heart attack, and you go into what we call cardiac arrest, where your heart stops pumping. You have no pulse. You're not breathing. There's no blood flowing through your vital organs, and one of those vital organs is your brain. So there's no blood flowing. Everything's stopped. Then Nature Coast EMS gets there, and we get the blood going again. Or your bystander gets the blood going again with really good CPR. And then we're going to give you some drugs. And all of that's going to cause reperfusion, what we call circulating the blood to those vital organs again. That sometimes causes an injury that's unrecoverable for some patients. And what induced hypothermia does is it slows that reperfusion injury. We give the body time to heal itself. By slowing everything down, by cooling them and bringing their temperature down to 91 degrees, we actually give the body a chance to heal itself. And then the hospitals who keep them at that temperature for 24 or 48 hours will slowly rewarm them, and then what's happening is they wake up and they go home. And that was not what was happening before.
It's amazing. So when they don't wake up, usually what happened to those patients?
Well, the statistics by the American Heart Association, it was 40% of the patients won't wake. I mean, only 40% of the patients do wake up. And this reperfusion injury was just phenomenal with all cardiac arrest patients. So the American Heart Association has recognized that induced hypothermia is so key in the recovery of patients that they've actually made it what they call a Class 1 recommendation for certain rhythm, VFib, out of cardiac arrest. So what they're saying is that it should be done on all patients that have a VFib, which is a certain rhythm cardiac arrest. And they've done a lot of research to back that up. But Nature Coast didn't need the 2010 guidelines to tell us to do that. We started it in 2008.
Well, we like to think we're clinically innovative and doing a lot of different things, and it's been, and you obviously know a lot about this and are the expert in the field and have spoken on it quite a few times, and we train our people to really do this. Why is the training so important? And tell us also some of the places you've gone to speak on this, and how you've kind of personally spread it throughout the state of Florida.
I have a commitment to the education of all pre-hospital providers and hospital providers on induced hypothermia, because there isn't any big drug rep that's going to advertise this, because nobody's going to make a lot of money on $10 worth of cooling packs and chilling the intravenous fluids. So there isn't going to be a lot of advertisement because a drug company's pushing this. But we saw and still see significant results with this. And it's our patients. I'm a patient's advocate. Nature Coast EMS, we want to be the patient's advocate. And these patients will benefit from this treatment. So it's kind of like some people were waiting for what they call a blind, double-blind study, which means let's do some more research. Let's give it to some patients, not give it to other patients. But we kind of feel that there's some things that we can see evident work. It's kind of like the parachute. Nobody did a blind, double-blind study on the parachute. They just know it works, and that's how we found out about it. We were asked, because we were the first EMS service in the state of Florida, that we were asked to share our results at a national convention in 2009. And we did. We went and spoke on it, and we actually had 2 of our survivors come and speak, and that was profound, because when we talk about data and we talk about medicine and what we do to change people's lives, when you hear it from the person who actually benefited from it, it really does make a different impact. And once again, we've been asked to speak, and I'm going to be speaking soon at another national convention on the same thing, because we're still trying to get people to embrace this treatment and to use it. It's not easy for the hospitals to do induced hypothermia. It is very easy for pre-hospital EMS to do it.
Well, Jane, your passion really shows for this, and it's exciting to see. And we've got a lot of other people at Nature Coast EMS with a passion for giving high-quality care. And when we come back, we'd like to talk about what happens when you may be a victim of a medical emergency and may not be able to communicate for yourself, and how you can notify your relatives if you're suffering from a medical emergency.
We were supposed to have coffee, and I found him like this.
Sir, can you hear me?
Is he a relative?
He's my brother.
Is he allergic to anything?
I don't think so.
I've got a weak pulse.
Is he taking any medication?
I don't know. I don't know. He's got this medical card thing, whatever it is, on his keychain.
That's what we need. Let me see it.
The invisible bracelet. It speaks for you when you can't. Electronic health information powered by the American Ambulance Association.
Well, I can really think of nothing more frustrating if I'm suffering from a medical emergency or we're caring for somebody with a medical emergency and we don't have information to contact their loved ones. Well, there's a solution out for that, and it's called IB Bracelet. I actually sit on the advisory board for the IB Bracelet system, and it's an identification system where for $10 a year per person, you can register on this site. And if you have a medical emergency, our crews or dispatch or even the hospital can look up the number and send a message to your loved ones to let them know that you've been transported to the hospital and actually which hospital you've been taken to. It's a great gift. It's a great way to keep people informed in a case of an emergency. But it's also a way for you to carry some of your medical information. You enter your medical information. It's stored securely online, so you can give it out. So it's a great tool for yourself. It's a great tool for the EMS providers, and it's a great tool for the physicians. If you're in a situation where you can't speak, or you can't remember your drug allergies, or remember what medications that you're taking. Well, this month we've been focusing on cardiac health and how to deal for victims of a heart attack and cardiac arrest. Before we close this episode of Every Minute Counts, we'd like to show you some stories of some of our cardiac arrest survivors.
For many victims, there's a feeling of nausea and general weakness. The chest pain is often described as being hit with a sledgehammer. It can feel like the breath has been knocked right out of you.
When your heart is acting up, you feel pain in your chest, but not necessarily your heart, and sometimes in your jaw, sometimes in your elbows and your arm and that sort of thing. And it's once you've had it, you know what it is.
For most people, the entire body goes slick with a cold sweat, and a feeling of impending doom washes over you.
You don't know what to do. You don't really know what to think. Nothing to do except let the doctors do their thing.
And without help, within minutes, your heart could go into cardiac arrest and stop beating altogether.
Well, if those first-hand accounts don't inspire you to come and learn how to do CPR so you can save somebody's life, I don't know what will. We encourage you to come and learn CPR wherever it is, but Nature Coast EMS, we do offer those. Thank you for watching this episode of Every Minute Counts. It wouldn't have been possible without our guests, Marcy Frashina, Jane Bedford, and we'd also again like to thank our sponsor, Easy Living Furniture, providing this beautiful set. Hope to see you next week. Bye now.